Good morning. My name is Akito Mosley,
I'm Valerie Magatsu.
I'm Augusto Silva.
and today we'll be presenting bullying and PTSD, a quantitative study measuring the relationship between bullying, PTSD, and academic performance. All right. So, a little bit of background on why we chose this topic. The three of us share one commonality, and that is that we've, at some point in our life, and maybe so have experienced some type of trauma, such as bullying, and we all share another commonality, which is an academic or collegiate career at some point, if that's for you. And so we wanted to examine just how trauma impacts the brain function and also academic performance. And so, so we wanted to examine how trauma negatively affects brain function and student academic performance. Next slide, please.
Okay, so our independent variable number 1 will be Zoloft medication. It is officially the first drug used to treat PTSD. The medication helps by increasing the neurotransmitter serotonin in the brain. Serotonin stays in the synaptic gap between neurons, enhancing moods in our patients. Number 2 will be our psychotherapy. That will be our second independent variable. This in product with our 17-item PSSI assessment. This therapy works by helping our patients overcome cognitive patterns in addition to decrease symptoms through exposure. Our dependent variable number 1 will be our amygdala function, so that will be the structure that we're specifically paying attention to. We will use an MRI to monitor large changes or hyperactivity in the amygdala in response to our stimuli. Our independent variable number 2 will be academic resilience, and this in product with our 30-item academic resilience scale, or the ARS 30. This will help us measure patients' behavioral responses to academic adversity.
So just to point out, our research question is, does bullying, post-traumatic stress disorder negatively impact brain function and student academic performance? Our hypothesis is that there is a negative relationship between bullying and PTSD, brain function, student academic performance. So we come to the next one here. So what exactly is PTSD? Post-traumatic stress disorder is a disorder that can occur, a psychiatric disorder that can occur in anyone who experiences a serious accident, witnesses a traumatic event such as a natural disaster, serious accident, war, combat, rape, and other violent personal assaults. In the interest of our study, the other violent personal assault that we'll be looking at is bullying, which is a form of aggressive behavior in which someone intentionally and repeatedly causes another person injury or discomfort. Bullying can take many different forms of physical, words, or other violent personal assault. And so we'll speak about 6 different types.
Most common is physical bullying, but a growing factor is definitely cyberbullying, since all of you have cell phones. Actually, a lot of kids are given cell phones early. We're highlighting cyberbullying specifically because it is one of the most common and growing forms of bullying. In 2018, 90% of teens reported having a smartphone. Cyberbullying is on the rise, and the impact of this problem is quite often actually underestimated or measured. So our study translates that traditional or cyberbullying may have a large negative impact on adolescents and college students' academic performance when childhood abuse or foster status is not looked at in our model. So we tend to want to have we like to filter out like people that have foster status or childhood abuse previously. We don't want to measure for that.
All right, so we'll be looking at trauma and brain function, and the limbic system is what regulates learning, memory, emotion, and the key main components in PTSD that we'll be looking at is the amygdala and the hippocampus. Now, the amygdala is your emotional alert center. It helps you to detect threats in the environment. It helps to process the traumatic memories that we experience. That's different from the hippocampus, which consolidates normal memory. The hippocampus, again, consolidates normal memory, which is different from traumatic memory, and helps us to store and retrieve those memories. Now, when we experience trauma, the amygdala becomes overactive, And there was one study done at Stanford University back in 2013. Children who suffer from bullying showed significant differences in their size of their amygdala. In boys, the volume was greater than in girls. The large amygdala have been linked to anxiety in adulthood. So the amygdala is an evolutionary primitive part of the brain, size of an almond, that helps with aspects of learning, perceiving stress, processing stress as well, emotions, survival instincts, and memory functions.
All right. So bullying and PTSD. This is our research design. There's this really good research right here by Holt, and we basically did this like just how we would do in a research. Like we have the abstract, the number of participants, the methods, the results, and the treatment. So for our abstract, this is what we're trying to do. We're trying to study whether suffering childhood bullying is associated with college students experiencing PTSD symptoms. We also measure the impact that these symptoms have on their amygdalas, and we will also want to know if that affects academic performance. So since this is experiential research, we chose 413 first-year college students. They're all freshmen. And how we measured that? So these students, they were asked to complete an online survey to assess past bullying experiences, current psychological and academic functioning, in addition to answering those questionnaires that Valeria was talking about, the PSSI for PTSD, the ARS-30 for academic resilience, and afterwards we also utilized the functional MRI to assess amygdala function. So results, regression analysis, like when we looked at this quantitative when we looked at this research, we analyzed that all these reports indicated that indicated that there was an increase in amygdala function, and these college students, they also experienced problems with academic resilience, like low grades. One day you go to class and then you don't feel like going, so we start like skipping classes and things like that. And then we came up with a treatment. So So this is how we did it. So it's a 2x2 design. So there's the first one is the psychotherapy plus control. So for the treatments, we think that there's two options for treatment. We can also do the Zoloft, which is a SSRI drug, which is commonly used for PTSD symptoms, along with psychotherapy. So the first group would be the psychotherapy plus the control, which is going to be a placebo medication. The second one is control, placebo, plus I was thinking about this one. They're basically going to talk to a psychologist, but they're not going to do the treatment. So that way we have a control group. The psychotherapy and the Zoloft, which we think is going to be the most effective group, which is a combination of the medication plus the psychotherapy, and also the Zoloft and the control group to analyze if the psychotherapy is also efficient. So for conclusions, we concluded that childhood bullying is associated with college students experiencing poor amygdala function, poor mental health, and poor academic resilience. And we also concluded that the most effective treatment is group number 3, which is the Zoloft plus the psychotherapy. Next. So this is a couple of statistics tables that I found. I'll keep it really simple because there's a bunch of numbers there. But if you look right here, you see that they had significant results, right? So findings indicate that college students with histories of bullying were more likely to be depressed and suffer academic problems than their non-bullied peers. And the second table here shows that previously bullied first-year students endorsed significantly more symptoms of depression and anxiety.
So based on a similar study, since we looked at a lot of different studies, I found one that was actually a government-funded study. According to the Johns Hopkins study, they used the 488 children suffering from anxiety or social phobias who were treated. After 12 weeks, 24% of the placebo group improved, 55% of the Zoloft group improved, 60% of therapy group improved, But with the combination of Zoloft and therapy, striking 81% improved with that treatment. So there was definitely some large improvements there.
Alright, so this goes back to how we measure the visual activity in the brain. We use the functional MRI. So if you look at this is the amygdala. So we have two amygdalas, right? One on each side of the brain. So we expect similar results in our study when we put these college students under the fMRI machine, and we also are gonna ask them to do the PSSI questionnaire, because when they take the questionnaire, there's gonna be some really important questions there to analyze how they feel about the PTSD symptoms that they experience. So like when were you bullied for the first time? How did you feel about it? And what type of impact? We want them to feel those symptoms again, so we can look at the amygdala and see if it's going to show any activity or not, which in this case it did.
So, according to all of the studies, we gathered information to see how some of that can be improved upon in their studies in particular. Future studies may build on our findings and study large populations as well as academic achievement in other types of educational settings, such as a private school, an online school, or to determine if students differ based on educational settings. Childhood bullying victimization is associated with poor mental and physical health among first-year college students in particular. College students should consider assessing histories of bullying and victimization along with other past victimization. So a history could definitely have an effect as well. And we should have the bully survey student version of the California bully victimization scale implemented in mass school districts and whatnot. So we can kind of keep track of who's experiencing these symptoms, so we can get ahead of that and treat people earlier.
Are any questions?